My name is Dr. Kingsley Obodo. I'm a consultant obstetrician and gynecologist, a graduate of College of Medicine, University of Lagos, a fellow of the National Postgraduate Medical College of Nigeria. I'm a consultant obstetrician and gynecologist, like I earlier said, and with key interest in fertility. So I'm a fertility expert. Now, one of the issues that we have with in this environment is the issue of inability to conceive. Here in St. Ives, we are focused and result-oriented to helping women achieve their desire in getting pregnant, which will bring a lot of joy to most of our couples who are desirous in having this achieved. The experience in St. Ives has been tremendous so far. The journey so far has been quite pleasant. We help women to achieve this by going the extra mile in doing what is needful in helping this couple. So in terms of training, you can get the best training in St. Ives. In terms of using the best technology available, yes, we do that here in St. Ives. So it's actually quite very educative and also very helpful. We have a friendly environment where you can easily get in touch with each section of the unit, and we work as a team here. Well, the three healthcare challenges for Nigerians so far, you have the issues. Generally, we have issues with fundings. Government fundings is very poor, so you have infrastructural decay. There's no facility especially in our government institutions, and also training. You have them. Training is deficient because government funding and training of such institutions is dwindling over the years. So those are the challenges that we have in our healthcare sectors. Well, Nigerians particularly, issue of poor education. People don't seek help easily. So they tend to go to other places before they eventually, when the issues are not resolved, they eventually come back to you, the specialists, and by that time a lot of damages will have been done. And also issues of accessibility and poor. When they go to especially government-funded institutions, you have issues. There's no light somewhere, infrastructural decay. Those are the issues that are peculiar with Nigerians, and that's why they don't tend to seek help easily. They feel that a long wait. Why will I go to a facility where I will have to spend more time in waiting for care and all that? And that has been, they want a quick fix, which would tend to make them go to facilities where they will not be able to get easy help. Healthcare tips I want to share with individuals is that one is that when you are sick, consult your doctor rather than go to an over-the-counter pharmacy or whatever to go and procure drugs on your own. Not all ailments are what you assume it is. So you seek help easily and go to a recognized health facility where you'll be able to seek help easily. Then, of course, for the women folk, annual medical checkup, especially cervical pap smear for our women folks, because we know that one of the most preventable cancer of the woman is cervical cancer. So they should do their routine pap smear and all that. So those are the areas where they should look at. I think basically general public is the issue of cervical cancer. Most people are ignorant in that fact that it is a preventable illness. It is a preventable illness. Cervical cancer is a preventable illness. It takes 10 to 15 years for it to transit from the state of pre-malignant lesion to become frank cancer. So just regular pap smear alone will be able to prevent cervical cancer. Then secondly, for breast cancers, Self-breast examination, especially during the menstrual flow, it's very, very helpful. That could prevent, and where you detect any lump or whatever, for people who are less than 40 years, should do their breast scan, and people who are above 40 years should have a mammogram done. One of the funny, strange incidents I had while working in the job, I had a client who came in. This was like 8 months after she had had a baby, and she just complained to me that she was spotting and bleeding, and she had been she noticed her abdomen was increasing in size, and she wanted to lose the abdominal fat. So she was already using an abdominal girdle and all that. So all I did was just do a quick scan right there in my office, and I discovered that she was like 15 weeks pregnant, which was like a surprise and even a joy to the family. And then we had to begin antenatal registration.